6:45, time for House Call Now. March is Colorectal Cancer Awareness Month, and in our region, Saline, Gallatin, and Hamilton counties have significantly higher incident rates of colorectal cancer than the rest of the state. It is the third most common cancer among both men and women in Illinois. Dr. Satyadeep Bhattacharya is here now with more details, and he is from Southern Illinois Healthcare. Thank you so much for joining us, Doctor.
Thank you. Pleasure to be here.
Talk about the signs, the symptoms that folks may experience with colon cancer.
So, you see, one of the problems with colon cancer, like a lot of cancers, is that early on in the course, people may not have any symptoms at all, which is why we do screening. But as cancer gets more advanced, you can get symptoms like bleeding in stools. You may get any changes in your bowel habits, like constipation, even sometimes diarrhea, alternating diarrhea and constipation. You can have feelings of bloating, cramping, and then there's a myriad of symptoms that you can get with spread of cancer to other organs. And that really depends on the organs that are involved.
And so what are some things, tools to use to detect? Because you mentioned that a lot of times once the symptoms start showing up, it's there.
Yes. Now, colon cancer being such a common cancer, and because it doesn't cause a lot of symptoms early on, we do screening processes. And with time, the best screening test that's really there for colon cancer is a colonoscopy, which is why we start screening for colon cancer at 50 years of age, because the majority of colon cancers occur in people over the age of 50. And at this time, we enroll people in screening processes. And now, if someone has a higher risk of colon cancer based on their family history or presence of inflammatory bowel disease or something else, then we alter the screening protocols accordingly. And for an average healthy person, we would start screening at age of 50, and then if there's no abnormalities that are found on the colonoscopy, then we may defer the screening for another 10 years.
Oh, wow.
And then do it every 10 years. Whereas if there's any abnormalities that are found, polyps that we take out, because most colon cancer now starts from polyps, and they grow over a period of years into larger cancer, and that then invades into the surrounding tissues.
Are there things that we can do to kind of keep ourselves healthy and prevent colon cancer?
Yes, to a large extent we can, in terms of altering the risk factors. Now, a diet that is rich in fiber and low in red meats, avoiding smoking, avoiding alcohol use, having a healthy active lifestyle, all of those would contribute to decreasing your risk of colon cancer. Then again, there are some risks that we can't really take away, like a positive family history of colon cancer, which automatically puts you at a higher risk. Things like having inflammatory bowel disease, where we just have to be extremely vigilant to scrutinize these people and keep them under surveillance.
Alrighty, some good advice here, and we will have all this information on our website a little later this morning. Doctor, thanks so much for joining us.
Absolutely, my pleasure.
Appreciate it.